everyone. Welcome to the Helium Health Podcast. My name is Francesca Modi, and our guest today is Mr. Wole Olarewaju, the CEO and founder of 24 Discovery Careline. Welcome.
Thank you for having me.
Yeah, how are you doing today?
I'm very well, thank you.
Okay, amazing. So, diving right into the questions, we want to know all about you, all about Discovery Careline, 24 Discovery Careline.
All right.
So, feel free to be as expressive as you want.
Okay.
First things first, though, what is it about the medical field that made you want to work in it?
Okay. Firstly, I'm still trying to connect the dots. I really don't know why I'm here. I think it's a little bit of destiny and passion to help other people.
Okay.
And I had a little bit of experience a few years back when I had my first child. It was at University College Hospital. It was actually born with a congenital disease,
Okay.
and we had to myself and my wife, we had to spend about 3 months
Wow.
in the hospital, and I was able to see how before that time I've never really been to a hospital, like never really experienced the hospital life, and I was able to see how rotten the medical sector
Yeah.
and the whole hospital system of our country. I was able to see it firsthand, and that period I was that period exposed me to how things are being done, like from the grassroots. It's not just about the government. Every
Yes.
time we keep blaming the government about the things that are happening in the country, and we as a people, we are not helpful. We are not contributing our quota to develop the country. And I was able to see a lot of things. One of the things I saw was in terms of medical diagnostics, during the period of our child's treatment and our time in the hospital,
Yes.
we had to do a lot of investigations because the congenital disease was actually something that was rare.
Oh.
It's not something that is common to every child, or high
Yeah.
percentage of children that were born. He was too young. It was actually called choledochal cyst.
Oh, that's a
So
big name.
yeah, he had a cyst, and
Oh.
he had to be operated on at that age. It was just 3 months
Oh, okay.
plus. So he had to be operated on, and there were a lot of investigations that were needed to were needed to be done for the doctors to know how to approach the procedure that
Okay.
they were going to do. So on one of those visits to the medical laboratory in UCH, you know, instead this the medical business is firstly all about care.
Of
That's the
course.
first thing a medical practitioner should actually consider
Yeah.
before anything else. But there is this nonchalant attitude from those guys, from those workers. It's either because they are not being taken care of properly, it's either because they just don't care, or they are just there just to pass time and collect their salaries at the end of the month. So the attitude was wrong. And at some point, I felt the results they were even giving us were not
As accurate
as accurate as it should be. So it was part of the things I felt, really affected the results. I mean, the end result of the whole experience in UCH. Because after all that, after the procedure, after everything, we still lost the child. So that was like a point for me where
Yeah.
I actually thought about it and said, we can't continue living this way in this country. And after that,
Mm-hmm.
the quest for me personally to do the right thing and to to see if I can contribute my own part to this sector
Mm.
made me consider, going into the health sector.
Yeah.
But it wasn't a medical laboratory at first. It
Yeah.
was it was telemedicine.
Oh, really?
I was actually trying to do telemedicine.
Okay.
So, but the opportunity came for me
Yes.
for this, and I grabbed it.
I mean,
And
I'm so sorry about the loss of your child to
it's
start
okay.
with, but I understand how the healthcare system as a whole
Mhm.
can lead you to, want to make a change.
Sure.
And your personal experience with the Nigerian healthcare
Mhm.
system is what has led you to work in the medical
Sure.
field.
Sure.
And it's really something. Okay. So even as you are now working in the medical field,
Mhm.
we understand that some days may be really good and some days may be like really bad.
Yeah.
So what are like some of your experiences so far working in the healthcare system?
Well, yeah, there's some good days. The good days are the days that you're just satisfied with this kind of service you're offering people, the kind
Mm-hmm.
of care you're giving people.
Mm-hmm.
But the bad days are those days that some people come with some helpless conditions that
Yes.
you deep down in your mind, you know that this guy is going nowhere.
Mm-hmm.
He's probably going to lose it. Those those days are very, very very, very demanding in terms of your emotions because you don't know what to do. You don't know how to help. Some people even come and they don't have money to for those tests that they want to do, but
Mm-hmm.
you don't have a choice. You have to find a way to balance and compromise.
Yeah.
Sometimes. So those are the kind of experience we
That you
have
have.
daily.
But what do you
Yes,
really
so-
enjoy the most about working in the medical field? What's it? What do you enjoy doing?
The only thing that we enjoy is the service we give.
Oh,
Really,
really?
the service is the caring for people is fulfilling.
Mm-hmm.
There's nothing better than that in terms of we as human beings.
Yes.
That's what we. That's love firsthand.
Yes. I
So
agree. I totally agree. Okay. Amazing. So now let's talk about your practice, 24 Discovery Careline. What drove you to, start the business and how has it been like this whole time?
running a business in Nigeria is it's like an extreme sport.
Tell me about it.
There are a lot of risk involved. Risking everything,
Mm-hmm.
and you probably will not get anything in the nearest future. But there's so many discouraging factors.
Okay.
Funding is one. Um, Ability to educate people because in our own part of the medical business, which is the medical investigation and diagnostics.
Okay. Yeah.
People need you need people to have a reason to come to you for investigations.
Of course.
You know, but but it shouldn't be so. You don't have to be sick. You don't have to get sick. You don't have to fall sick
Mm-hmm.
before you actually come for tests.
Mm-hmm.
So it's up to us as practitioners, businessmen. The only kind of marketing we should do is actually to educate people
Mm-hmm.
on why they need to, check their body from time to time, check their status
Of
from time
course.
to time. So that's a bit challenging because getting people to test
Mm-hmm.
for anything it's a very tedious work.
Yes.
So education is very important when it comes to, you know, that's one of the things that we pay attention to.
Mm-hmm.
We try to educate people and make them know the reason why they should
Yes.
check
I mean,
their
I've
body
always
system.
heard that preventive care is way better than reactive
Of
care.
course,
So
of
that's
course. Yes, that's the most important thing. So that's why people should know that they need to test
what, of course.
from time to time and not wait for them to fall sick or have any ailment or anything before
Okay.
do investigations.
Okay. So this is what the 24 Discovery Careline is built on.
That is
getting the people to
to have a reason to know,
Mhm.
getting the people to know, getting the people to understand the need to
Yes.
investigate and to conduct those tests from time to time.
Okay.
Yeah.
Amazing. I think that you do such an amazing job because education is a really important part of the health system in Nigeria. And the more people know, the more people are aware, the better our healthcare system will be. I
Sure.
believe so.
Sure that.
Okay. So now talking about the broader healthcare system, how important is it for easy access to financing for the healthcare sector?
See, in terms of financing in the health sector,
Mm-hmm.
the HMOs come in, the um, the government as well have a role to play.
Of course.
So the most important reason why funding is needed is that the access actually.
Mm-hmm.
People should be able to access this healthcare at every point in time without considering if it's going to be too expensive or not.
Mm-hmm.
So that's where the HMOs and the government come in. They need to be able to subsidize a lot for people to be able to access this healthcare system.
Okay.
Yeah.
And then a system that doesn't have financing, I know, like, really though, I want to know from your experience, how difficult has it been getting access to fund? Was 24 Discovery Careline funded by investors? Was it easy for you to, what was it like during the finance process?
It's never easy. It's never been easy. We don't have any investors. It's
Yeah.
personal funding, and
Yeah.
it's been difficult, very difficult, because you spend money a lot and you don't make it back.
Mm-hmm.
The way you feel you should have, like the way you do in other businesses.
Mm-hmm.
But it's been good, but it's not easy to get funding,
At all.
even from the banks.
Yeah.
It's very hard.
So I hear you when you say that access to financing would make, healthcare a lot cheaper for people. So out of pocket expenditure would be reduced.
Exactly.
But what else would financing do for you, even as a health facility and as a business owner? How would the financing even ease, your experience in the medical sector?
Yeah, there's so much to do.
Mm-hmm.
There's a lot to do. There's a lot of opportunities to tap into.
Yes.
Without funding, you can't achieve those things. We want to grow. We want to be bigger.
Yeah.
We want to increase our capacity.
Yes.
But without adequate funding,
Mm-hmm.
we are going nowhere.
Of course.
So we remain where we are. So if the funding comes, fine.
Why not?
Why not?
Okay. All right. So we know that you have tried Helium Credit.
Yes.
So what was your experience like? And how helpful has it been to you?
Well, coming from 2020, a great year.
Mm-hmm.
We're all locked down for months.
Yes.
There was really no business for us at that point because our location is quite far for most of our staff.
Mm-hmm.
So we were like handicapped for a long time.
Yes.
So Helium Credit came at the right time for us, and we were able to pick up ourselves and start all over again this year.
Mm-hmm.
So far, so good.
I like how you said Helium Credit came at the right time. It just goes to show how, financing and credit from, Helium Health has been able to ease your work processes, ease your flow. It's been able to give you an opportunity to even recoup what you must have lost during the pandemic.
Sure.
It's beautiful to see. Okay. So if you could change one thing about how the healthcare sector currently works in this part of the world, what would you change?
Well, I would like to change so many things if I was given the chance to.
Okay.
But one thing that is very important right now is government policies. We need our government to be more responsible.
Okay.
We need our government to take this health sector as a very, very important sector. You
Okay.
know, we need our government to understand that a healthy nation is actually a wealthy nation.
Of course.
Without a fantastic health, there is nothing we can achieve as a nation.
Mm-hmm.
So they are still joking with the economy of this country. Without this health sector, the
Mm-hmm.
economy is going nowhere. So they need to understand that the health sector is actually more important than
Mm-hmm.
most of the things they are doing.
Okay. Fair enough. So I hear you when you say government policy with regards to the health sector in Nigeria. That would be like the number one thing
That
that you
would
will
change.
change.
Yeah.
Amazing to note. So this is where we really come to an end with our getting to know 24 Discovery Careline and knowing how the financing has been, how Helium Credit works for you and your facilities. Is there anything you would like to add? Is there something else you'd like to note?
Huh? Not really, but I would like to say you guys are doing a great job. You guys are doing the Lord's work in Nigeria.
You can say it again.
You guys are doing the Lord's work in
Yes.
Nigeria.
Yeah.
Where the government is lacking, you're trying to fill. And
Mm-hmm.
I also like the fact that you're trying to build a data system,
Yes, of course.
for Africa. That's one of the um, things we are lacking in the health sector. There's no data to work with.
And we all know how important
It
data
is
is.
very, very important.
Yes.
Very important. Data is actually life right now. So,
Yeah, it is.
yeah, so that's all I have to say.
Thank you so much, Mr. Wole Olarewaju, for joining us today.
Thank you
It
for
has
having me.
been a pleasure.
Thank you for having me.